We went to the emergency room because he started having really bad pain in his side. In the emergency room, they took a CAT scan, and I remember, I'll never forget, seeing the ER doctor out looking at the scan, and she had called over other people to look at it. She kept shaking her head, and I knew that something was wrong. She called it like a hamburger-sized tumor on his liver, and she wasn't exactly sure if it was cancerous or, if it was anywhere else. They did some scans, and they found out that it was cancer, and that it was spread to his lungs and his lymph nodes at that point. It was stage 4. When I took the pregnancy test, I thought I was just under stress, and it couldn't be that. When I took the pregnancy test and it came up positive, I had to just laugh and be like, really, God? And at first he was kind of upset about it. He was like, this was a bad idea. What happened? Why did we do this? And I was like, it's going to be fine. I just knew in the pit of my stomach that it would be fine and that it was the right thing. And I knew that it added a whole level of difficulty to taking care of him, me being pregnant, but I knew it would be fine. And it did. Everything worked out perfectly. That there was no way he was going to make it to see the baby. And that was a really hard day for me. I did a lot of crying that day because I knew that we were so close, and I really just wanted him to be able to see the baby. So when he got readmitted to Palm Beach Gardens Medical, he was in really bad shape. And at that point, we still weren't sure if he was going to make it. And we had some decisions to make on whether to take a risk and put him upstairs and have all these tests done and procedures and things done for him, or if we just went the hospice route. But knowing that we were so close and that he really wanted to see the baby, and I talked to him, he was completely there in his head. And he really wanted to keep going, even though he knew it would be painful. And he knew he was in real bad shape, but he wanted to keep going.
I remember meeting Jen in the hallway. She was talking to one of the physicians. I didn't know anything about Adam just yet. It was the first day they had been there. And Jen at the time looked very pregnant. I found out she was 9 months pregnant at the time, and she was very distraught in the hallway. I had gone up to them just as a director at the time, gone up to see if I could do anything to help. I found out at the time that Adam had terminal cancer. His goal and his wife's goal was to be there for the birth of their second child. So with the physicians we had in place and the nursing team, that was our goal, to get him to see his daughter.
Yeah, when we first got here, I remember, I knew our story, but I'm sure it was a little shocking to see, the situation that we were in. And immediately they made me feel like they cared. And that was really important, and I really needed that at that moment. I remember a couple of times some of the nurses crying out in the hall with me, and me telling them that they need to keep it together for me because, I was trying to keep it together too. But immediately they treated us like family. And I knew that he was safe here and that he would be well taken care of. And that was another huge thing for me. I never felt like he was going to be left there without something that he needed, or left without the comfort of someone.
I couldn't imagine going through what she went through. I don't know how she stayed strong like she did. I wouldn't be able to. It was very difficult to see it, but there was no way that I wouldn't do everything I could to help her and help him reach that goal. I couldn't sit back and say that I didn't do everything under my power to let him and her meet their child for the first time.
And I couldn't stay here with him. So leaving him for the night, made me feel comforted. They were there, and I had, another set of eyes and someone else who would make him feel better. Oh, we'd interact all day. With one of them, I would come out to the nurse's station if I needed a minute to come out and breathe, and they would help me feel better and hug me, and then at the end of the pregnancy, I really felt like they were my family. I was so excited about the baby and excited to see the baby, and it was just really special.
It was just, from the get-go, it was, their story, and oh my God, she's pregnant, and terminal cancer, and you know, I'm married, I have kids, he's my age, you know, it could have been my husband, and anything we could have done, we would have done it.
And really made me see clearly how amazing they are. You know, you think of a nurse as a job, but these people are not doing it as a job. They're doing it because it means a lot to them, and you can really see that when they have so much emotion and are so helpful, and they go above and beyond, and you know, they hold a special place in my heart.
And then he comes up to the floor with his dad. I'm there, welcoming to the floor, and he goes into details of how his wife is 9 months pregnant, and he just wants to see his baby daughter be born. It was heartbreaking. You couldn't leave that morning without just like feeling for the family. And you don't know what's gonna happen. You don't know if he's gonna make it. It was terrible.
But I've never seen a family or a patient as strong as they all did through the entire thing.
Mm-hmm.
The mom, the dad, the brothers.
Jen.
Mm-hmm.
Yeah. Yep. And I remember how quiet he was when he first arrived. That, you know, it was hard for him to open up, but as we got to know him, he became like family to us. And he was, you know, telling us how much he couldn't wait for Addison to be born. And we ended up Melissa helped organize a baby shower for them, which was great. We had the staff come in. It actually happened to be around the time of his birthday, which was June 9th. So we were able to combine that. And the family couldn't have been more happy. You know, during this, there's not much we can do as nurses and as professionals to make this situation probably any less tragic for them, but I feel like these little small things that the staff did just made a difference.
He also turned 36 in the hospital. So I was working that night. Midnight comes around. We walked in, we sang him happy birthday right at midnight. I mean, I think if he could, he would probably have cried.
It takes a toll on a nurse to take care of a family and a patient like this. So I did handpick these ladies because I knew that they could do it and provide such a special, you know, interaction with this patient and their family.
The day I heard she gave birth, I called our EVS team. He was in dialysis at the time, going daily. So when he was out of his room, I made sure EVS came up and did a deep cleaning of his room. I made sure that our patient care techs knew to go in and give him the best bath possible with our, you know, particular soap that is the strongest to help kill any bacteria, so that the baby had the best chance of being in the hospital and not having any harm done to her. He had the best chance of seeing her and just that whole experience. And
the day that Addison came for the first time, Jen had come and, you know, they spent a good amount of time with the door closed and we gave them their privacy. And then, you know, about 45 minutes later, an hour later, she came out and she, you know, the mom, Adam's mom, came out and was like, came up to me and was like, okay, you want to come in and you can meet the baby and, you know, let's come in. And so I walked into the room and he's propped up on pillows and baby Addison's propped up into his arms and his face was so happy. He just glowed. He was so proud and so happy. He made the goal and it was such a happy day. We cried happy tears all day long. It was the most amazing sight ever. I'll never forget it, ever.
I do consider them heroes because they made this whole experience less painful. I mean, a tragic experience, and they made it less painful for me. They empathized with me. They cried with me. They hugged me. They made us feel like family, and at that time, I really needed that support. I just want to tell them that we're so thankful for their hospitality, for their kindness, their generosity, for going above and beyond for our family, and making us feel like it was home. It meant so much to us, and really was a game changer for me.